Hi parents, good morning and welcome to this video. My name is Dr. Chifor Terry, aka your favorite baby doctor. There's a question I got asked in clinic last week and it got me thinking. And what was the question? Doctor, what do I do when my child is choking? Or what can I do to help a child that is choking? I think this is something that we commonly see, especially when children are starting to eat complementary feeds or when they are eating and they are running around, they can easily choke. And at times as parents, we are helpless. It is very frightening. But after this video, relax. I'm going to walk you through the steps so that if your child happens to choke, you are empowered and you know what to do. The first thing is, how are you going to know whether your child is choking? With me, we have baby Anne, who's below 1 year old and is 3 months, and she's going to help us understand these steps. How do you know that your child is choking? They will not be breathing, they'll be looking at you, they'll be unable to cough, or able to talk or cry. That shows you that the child has probably choked and this child was eating or running around or had an object like a bead or something. You can suspect that this child is choking. Intervening at that moment is going to make a big difference on how that child is going to turn out. So this is Anna here, this is what you do. Anne was just eating her potatoes here and I noticed that Anne stopped breathing, she stopped coughing, and she was just looking at me. I think Anne has choked. So these are the steps that you do. First, you want to turn Anne on your lap and you hold Anne's, you support Anne at the level of her jaw such that her airway is open and she's a bit tilted behind. This maneuver is very important because if you do this, you prevent her from breathing and you can injure her eyes. So make sure that with your 2 fingers, you're holding Anne's jaw and you put her just below your back, just on your lap. You put her on your lap. Then secondly, you want to use the heel of your palm. And what are you going to do with the heel of your palm? In between her 2 shoulder blades here, you're going to give 5 solid thrusts, just average energy. Don't break Anna's chest. So watch me do it. 1, 2, 3, 4, 5. So you see I am giving a thrust upwards, and what this is doing is it is helping to dislodge the object that is blocking her airway. So if you do this and you notice that Anna is still not breathing and she's choking, you can turn her now to her tummy and you try this maneuver. Still holding her airway open, she tilted a bit down. You use your 2 fingers and you put just below her rib cage, 2 finger breadths below her nipple, just at the bottom of her rib cage in the center, and you're going to do 5 thrusts. 1, 2, 3, 4, 5. You see you're doing this thrust and you're pushing forward. What this does is that it helps compress the air in the lungs such that this air can push whatever is dislodged in the tube and Anna can start breathing. If you do that and it doesn't work, you turn Anna back to the back and you continue to give your 5 thrusts. Holding the head down helps you make use of gravity so that the object can easily come out, and you continue sequence until the object is dislodged. Eventually, if this object does not come out and the child is not breathing, you have to convert now to CPR. If you want to know how to do CPR, please refer to my video on CPR. I assure you, if you do this correctly, the object is going to come out and she can start breathing again. Once you have done that, I recommend that you take Anna to the hospital so that she can be examined by a healthcare provider to make sure that some of the objects or some of the food particles or whatever that blocked her airway hasn't gone to her lungs. Thank you for watching. I hope you have learned something new. Please share this and save somebody's life. Until next time, your favorite baby doctor.